Well, good morning and good afternoon, good evening, everyone. During the next minutes, I am going to offer you a brief introduction about mesenchymal stem cells, the potential clinical applications of adult mesenchymal stem cells. The clinical data show us a broad field of application of mesenchymal stem cells. There is overwhelming evidence of their usefulness in regenerative medicine, tissue engineering, and immunotherapy. At present, there are a significant number of clinical trials exploring the use of mesenchymal stem cells for treatment of various diseases, including myocardial infarction and stroke, in which oxygen suppression caused widespread cell death, and others with clear involvement of immune systems such as graft versus host disease, diabetes, and Crohn's disease. Mesenchymal stem cells are multipotent adult cells that were first isolated and characterized from bone marrow. They were further identified by their ability to attach to the plastic of tissue culture tissues. In the bone marrow, the multipotent stroma of mesenchymal stem cells that have been isolated are part of bone marrow microenvironment, together with endothelial and reticular cells, adipocytes, osteoblasts, and macrophages. In this context, mesenchymal stem cells are involved in many key events related to hematopoiesis, immune cell regeneration and activation, immunomodulation, and immunotolerance. Here you can see in the diagram the sources: bone marrow, fat tissue, and blood vessels. The mesenchymal stem cells have many functions. They can differentiate into osteochondro, myostroma, tino, adipocyte, and they have exosomes in the mitochondria, and they have a lot of cytokines and growth factors. The sources where you can find are fat, bone marrow, aspirates, umbilical cord tissue, spleen, placenta. And very important is that human mesenchymal stem cells do not express the hematopoietic markers. They have proper CD markers. In the case of tissue, of cord blood tissue, they are around the 3 vessels, and they occupy the 80% of this space. The goal of the cell-based therapies is to use a strategy that includes a combination of activities that aim overall to replace, repair, or enhance the function of cell type, tissues, organ, or system, using intact, amplified, or modified autologous or allogenic cells. From the philosophical point of view, adult mesenchymal stem cells have a clear advantage over embryonic or fetal stem cells in terms of basic biological aspects related to immunotolerance, differentiation, and transformation. The clinical use of allogenic mesenchymal stem cells for preventing or treating acute graft versus host disease date back to the 70s. Bone marrow mesenchymal stem cells are mobilized in response to tissue injury, such as hypoxia, ischemia, or necrosis, along with a variety of mediators associated with tissue damage. These cells migrate and settle in the damaged tissue and interact with resident cells and the stroma, secreting very important bioactive molecules that modify the redox potential, modulate apoptosis, induce cell proliferation, and recruit other cells, both stem and non-stem, which continue the reparative process and regulate the local immune response, as you can see in the diagram. How about the immunomodulation? The first reported immunomodulatory activity of mesenchymal stem cells was the inhibition of T cell proliferation. They act through intercellular interaction and release a myriad soluble bioactive factors, have an inhibitory effect on the activity of antigen-presenting cells with impact on T cell function. The immunosuppressive activity is exerted via inhibitory mediators. They induce upregulation by many ways that contribute to immunosuppression. inhibits CD4 positive and CD8 positive T cells, the cytotoxic function of resting natural killer cells, and generation of innate and adaptive immunoregulatory cell populations, and upmodulate secretion of interleukin-10 by dendritic cells that acts on T cells. And it has also been suggested that mesenchymal stem cells suppress the B cell proliferative response. Here you can see the different actions. In one way, the immunomodulation, like for example, the inhibition of pro-inflammatory cytokine release or the inhibition of proteases release. On the other case, the antimicrobial activity. And in the case of their transplantation, they can go to the cell transdifferentiation or the recent studies about the nanotube formation and the exosomes, including as a new potential treatments. In conclusion, clinical data show a wide range of potential applications of mesenchymal stem cells. There is overwhelming evidence of their usefulness in regenerative medicine, tissue engineering, and immunotherapy. No malignant transformation of implanted cells has been reported in patients. Not raise any ethical issues, such as those related to use human embryonic stem cells. Mesenchymal stem cells migrate to site of tissue injury in response to local signals, with critical phenotypic changes and intense paracrine activity that contributes to the reparative process. Among the mesenchymal stem cells, allogenic mesenchymal stem cells have unique immunomodulatory properties. Their immunosuppressive capabilities define their application in the treatment of diseases in which the pathogenesis involves uncontrolled activity of the immune system. These cells have shown promising results in graft-versus-host disease, diabetes, lung injury, Crohn's disease, and multiple sclerosis. It is important to mention the data related to the regenerative capacity of allogenic mesenchymal stem cells in cardiac, neural disease, as well as in diabetes. The capacity of allogenic mesenchymal stem cells to facilitate engraftment of other cells and their potential association with smart, careful use to seed other stem cells with regenerative purposes should be explored further. The limited availability of autologous mesenchymal stem cells has been a major obstacle to their application. This has been resolved by extended culture and expansion methods. How about the facts? Well, mesenchymal stem cells could ameliorate many diseases with immunoregulatory ability. They have antifibrotic effect and neovascularization features. Mesenchymal stem cells exert therapeutic function in different diseases, primarily through paracrine activities, and they have immunoregulatory function via the innate immune system and or acquired immune systems. The open questions are, what is the difference among mesenchymal stem cells derived from bone marrow, umbilical cord tissue, and adipocyte tissue in clinical trials? And the consensus of how to culture the mesenchymal cells used in clinical need to be designed. Well, this is a brief introduction before the main topic from today. Thank you so much for your sharing this day.